Question 1. A prescription reads lisinopril 10 mg number 30, sig. 1 per daily. What is the generic name for Zestril, and what drug class does it belong to? A. Lisinopril, beta blocker. B. Lisinopril, ACE inhibitor. C. Amlodipine, calcium channel blocker. D. Metoprolol, beta blocker. Answer: B. Lisinopril, ACE inhibitor. This question tests knowledge of common drug names and classifications, which is fundamental for pharmacy technicians. Lisinopril is indeed the generic name for the brand name drug Zestril, and it belongs to the angiotensin-converting enzyme, ACE, inhibitor class. These medications are commonly prescribed to treat high blood pressure and heart failure by relaxing blood vessels and reducing blood volume. For example, a patient taking lisinopril might be advised to avoid potassium-rich foods due to the drug's effect on electrolytes. Remembering common generic-to-brand names and their primary drug classes will greatly help in identifying medications and understanding their uses. Question 2. A prescription requires 500 milliliters of a 20% dextrose solution. How many grams of dextrose are needed? A. 20 grams. B. 50 grams. C. 100 grams. D. 200 grams. Answer: C. 100 grams. This question involves a common pharmaceutical calculation for determining the amount of solute in a given volume of solution based on a percentage concentration. A 20% dextrose solution means there are 20 grams of dextrose for every 100 milliliters of solution. To find out how many grams are in 500 milliliters, you can set up a proportion: 20g/100 milliliters equals xg/500 milliliters. Solving for x gives 100 grams. Understanding how to calculate amounts for percentage solutions is crucial for accurate compounding and dispensing. Question 3. Which of the following is a look-alike, sound-alike, LASA, drug pair that requires special attention to prevent medication errors? A. Ibuprofen and acetaminophen. B. Amoxicillin and ampicillin. C. Lisinopril and losartan. D. Metformin and glipizide. Answer: B. Amoxicillin and ampicillin. This question focuses on patient safety and the critical issue of look-alike, sound-alike, LASA, drugs, which are a major source of medication errors. Amoxicillin and ampicillin are both penicillin antibiotics, share similar names, and can be easily confused if not carefully checked. While the other pairs might have some similarities, amoxicillin and ampicillin are classic examples of drugs frequently mistaken for one another. Always double-check drug names, dosages, and patient information to prevent such dangerous errors. Question 4. What is the maximum number of refills allowed for a Schedule IV controlled substance if authorized by a prescriber? A. No refills. B. 1 refill. C. 3 refills. D. 5 refills within 6 months. Answer: D. 5 refills within 6 months. This question assesses knowledge of federal law regarding controlled substances, which is vital for safe and legal pharmacy practice. According to federal regulations, Schedule IV controlled substances, such as benzodiazepines like diazepam or lorazepam, are permitted to have up to 5 refills within 6 months from the date the prescription was written. After 6 months or 5 refills, whichever comes first, a new prescription is required. Adhering to these strict refill limits is crucial for maintaining compliance and preventing drug diversion. Question 5. Which of the following organizations oversees the accreditation of pharmacy technician training programs? A. FDA. B. DEA. C. ASHP. D. CDC. Answer: C. ASHP. This question tests knowledge of key regulatory and professional organizations in pharmacy, which is important for understanding industry standards. The American Society of Health System Pharmacists, ASHP, is the primary organization responsible for accrediting pharmacy technician training programs in the United States, ensuring they meet specific educational standards. This accreditation helps ensure that technicians receive high-quality education and training, preparing them for their roles in healthcare. Knowing the roles of various pharmacy organizations is essential for professional development and compliance. Question 6. A patient brings in a prescription for Synthroid. What is the generic name for this medication? A. Levothyroxine. B. Liothyronine. C. Thyroglobulin. D. Methimazole. Answer: A. Levothyroxine. This question tests a common brand-to-generic drug name recall, which is a frequent task for pharmacy technicians. Synthroid is a widely recognized brand name for the generic drug levothyroxine, a thyroid hormone replacement medication used to treat hypothyroidism, underactive thyroid. It's crucial for pharmacy technicians to know these common name pairs to accurately dispense medications. For instance, a patient might ask for the thyroid pill, and knowing the generic name helps confirm the correct medication. Question 7. What does NPO mean in a patient's medical chart? A. Nothing by mouth. B. As needed. C. Take at bedtime. D. By mouth. Answer: A. Nothing by mouth. This question assesses understanding of common medical abbreviations, which are frequently encountered in prescription orders and patient charts. NPO is a Latin abbreviation for nil per os, meaning nothing by mouth. This instruction is often given to patients before surgery or certain medical procedures to prevent aspiration or complications. For example, a patient scheduled for surgery at 8 a.m. might be NPO after midnight. Knowing these abbreviations helps ensure patient safety and proper medication administration. Question 8. A pharmacy technician receives a prescription for azithromycin 500 mg. Take 2 tablets on day 1, then 1 tablet daily for 4 days. How many tablets should be dispensed? A. 5 tablets. B. 6 tablets. C. 7 tablets. D. 8 tablets. Answer: B. 6 tablets. This question involves a common dosage calculation based on specific instructions often seen with antibiotic regimens. The prescription specifies taking 2 tablets on day 1, followed by 1 tablet daily for 4 additional days. This means 2 tablets for day 1 plus 1 tablet/day * 4 days, equals 2 plus 4 is equal to 6 tablets total. Accurately calculating the dispense quantity ensures the patient receives the correct amount of medication for their full course of therapy. Always break down multi-step instructions to ensure all parts of the regimen are accounted for. Question 9. Which of the following pieces of patient information is not typically found on a prescription label? A. Patient's address. B. Prescriber's DEA number. C. Pharmacy name and address. D. Drug's expiration date. Answer: B. Prescriber's DEA number. This question distinguishes between information required on a prescription label for the patient versus information primarily for the pharmacy or for controlled substances. While the prescriber's DEA number is essential for the pharmacy to verify and process controlled substance prescriptions, it is generally not printed on the patient's prescription label. The label typically includes patient information, drug name, dosage, directions, pharmacy details, and the drug's expiration date. Understanding what legally must appear on a label helps ensure compliance and patient safety. Question 10. What is the primary purpose of a therapeutic interchange in a hospital setting? A. To allow patients to choose their preferred medication. B. To switch a patient's medication to a less expensive but therapeutically equivalent alternative. C. To provide a different dosage form of the same medication. D. To substitute a brand-name drug for its generic equivalent without prescriber approval. Answer: B. To switch a patient's medication to a less expensive but therapeutically equivalent alternative. This question addresses a common practice in institutional pharmacy settings aimed at cost control and formulary management. A therapeutic interchange involves replacing a prescribed medication with a different drug that has similar therapeutic effects, often to reduce costs or to align with hospital formulary preferences, but always with a protocol or prescriber approval. For instance, if a hospital's formulary prefers omeprazole, a physician might initially prescribe pantoprazole, and a therapeutic interchange would switch it to omeprazole. This practice helps manage healthcare expenses while maintaining patient care quality. Question 11. Which of the following is considered a Schedule II controlled substance? A. Ativan, lorazepam. B. Valium, diazepam. C. OxyContin, oxycodone. D. Xanax, alprazolam. Answer: C. OxyContin, oxycodone. This question tests knowledge of controlled substance schedules, which is crucial for handling these medications legally and safely. OxyContin, containing oxycodone, is classified as a Schedule II controlled substance due to its high potential for abuse and dependence, despite having accepted medical uses. Schedule II drugs require strict handling procedures, including specific prescription requirements and inventory controls. Understanding the different schedules helps technicians identify which drugs require heightened security and regulatory compliance. Question 12. A medication order reads metoprolol 25 mg PO bid. How many times per day should the patient take this medication? A. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer: B. Twice daily. This question tests knowledge of common Latin abbreviations used in prescription writing, which is fundamental for accurately interpreting medication orders. The abbreviation BID stands for bis in die, meaning twice a day. Therefore, the patient should take metoprolol 2 times daily. Correctly interpreting these abbreviations is critical to ensure patients receive their medications at the right frequency, impacting treatment effectiveness and safety. Question 13. What is the correct way to dispose of controlled substances that are expired or no longer needed in a pharmacy setting? A. Flush them down the toilet. B. Throw them in the regular trash. C. Return them to the manufacturer. D. Render them non-retrievable and unidentifiable as per DEA regulations. Answer: D. Render them non-retrievable and unidentifiable as per DEA regulations. This question addresses the critical and highly regulated process of controlled substance disposal, emphasizing compliance with federal law. Controlled substances, especially expired or unwanted ones, cannot simply be thrown away or flushed. They must be rendered non-retrievable, meaning altered to the point of being unusable and unrecoverable, according to specific DEA regulations, often through specialized disposal services. This strict process prevents diversion and abuse of these potent medications. Question 14. A patient is prescribed cephalexin 250 mg capsules. What is the usual storage requirement for this medication? A. Store in the refrigerator. B. Store at room temperature, away from moisture and light. C. Store in the freezer. D. Store in a dark, humid environment. Answer: B. Store at room temperature, away from moisture and light. This question tests knowledge of proper drug storage conditions, a key aspect of maintaining medication efficacy and safety. Cephalexin capsules, like many solid dosage forms such as tablets and capsules, are typically stored at controlled room temperature, protected from excessive moisture and light. Refrigeration or freezing is usually reserved for specific medications like certain suspensions or insulins. Proper storage ensures the medication remains stable and effective until its expiration date. Question 15. The abbreviation DA1 on a prescription signifies: A. Dispense as written, no substitutions allowed. B. Dispense as written, generic substitution allowed. C. Dispense any available brand. D. Dispense only the generic if available. Answer: A. Dispense as written, no substitutions allowed. This question focuses on dispense as written (DA) codes, which dictate whether a generic substitution is permissible for a brand name drug. DA1 specifically indicates that the prescriber medically deems the brand name product necessary and explicitly forbids generic substitution. This means the pharmacy must dispense the brand name medication even if a generic equivalent exists. Understanding DA codes is essential for accurate and compliant prescription filling. Question 16. What is the beyond use date, BUD, for a non-aqueous compounded preparation, e.g., an ointment, if no stability data is available for the specific formulation? A. 6 months. B. 1 year. C. 14 days when stored at controlled cold temperatures. D. 30 days. Answer: A. 6 months. This question pertains to the crucial concept of beyond use dating, BUD, for compounded preparations, which differs from a manufacturer's expiration date. For non-aqueous compounded preparations, such as ointments or capsules without water, if no specific stability data is available, the USP less than 795 guideline recommends a BUD that is no later than 6 months or the earliest expiration date of any active pharmaceutical ingredient, API, whichever is shorter. This guideline ensures the stability and potency of the compounded product for patient safety. Question 17. A pharmacist asks a technician to pull a drug from the P-list of the pharmacy's inventory. What does P-list typically refer to in this context? A. Psychoactive drugs. B. Perishable drugs. C. Look-alike/sound-alike drugs. D. High-alert medications. Answer: D. High-alert medications. This question relates to patient safety initiatives and medication error prevention, often using common pharmacy terminology. The P-list in many pharmacies or hospital systems is an informal reference to drugs designated as high-alert medications. These are medications that carry a significantly heightened risk of causing serious harm to patients when used in error. Examples include insulin, opiates, and anticoagulants. Extra precautions, such as independent double checks, are often required when handling P-list drugs. Question 18. Calculate the body mass index, BMI, for a patient who is 5 feet 6 inches tall and weighs 150 pounds. BMI equals weight in lbs/ height in inches, (2, *703). A. 22.4 kg/m(2). B. 24.2 kg/m(2). C. 26.5 kg/m(2). D. 28.1 kg/m(2). Answer: B. 24.2 kg/m(2). This question requires a multi-step calculation, specifically converting height to inches and then applying the BMI formula. First, convert 5 feet 6 inches to inches, open parenthesis 5 times 12 close parenthesis plus 6 is equal to 60 plus 6 is equal to 66 inches. Then, apply the BMI formula, 150 pounds/66 inches, (2, asterisk 703 equals open parenthesis 150 divided by 4,356 close parenthesis times 703 is equal to 0.03443 asterisk 703 is equal to 24.2 kg/m². Accurate calculations like this are essential for dosing medications based on patient body metrics. Question 19. Which federal act requires that all dangerous and addictive drugs be labeled with the Rx-only symbol? A. Pure Food and Drug Act of 1906. B. Food, Drug, and Cosmetic Act of 1938. C. Durham-Humphrey Amendment of 1951. D. Kefauver-Harris Amendment of 1962. Answer: C. Durham-Humphrey Amendment of 1951. This question tests knowledge of significant federal pharmacy laws and their impact on drug labeling and dispensing. The Durham-Humphrey Amendment of 1951 specifically established the distinction between prescription, Rx-only, and over-the-counter, OTC, drugs. It mandated that drugs requiring medical supervision for safe use must be labeled Rx-only, effectively defining which drugs need a prescription. Understanding key legislation is fundamental for maintaining legal and ethical pharmacy practice. Question 20. What is the role of personal protective equipment, PPE, in a pharmacy compounding setting? A. To protect the medication from contamination. B. To protect the compounder from exposure to hazardous materials and to prevent contamination of the preparation. C. To protect the pharmacy from theft. D. To allow for faster compounding procedures. Answer: B. To protect the compounder from exposure to hazardous materials and to prevent contamination of the preparation. This question addresses the dual purpose of personal protective equipment, PPE, in sterile and non-sterile compounding, which is crucial for safety and quality. PPE, such as gloves, gowns, and masks, serves to both protect the pharmacy technician or pharmacist from potential exposure to hazardous drugs or chemicals, and critically, to prevent contamination of the compounded preparation itself. For example, wearing sterile gloves during aseptic compounding prevents bacteria from the skin from entering the final product. Always use appropriate PPE to ensure both personal safety and product integrity. Question 21. A patient presents with a prescription for warfarin 5 mg, take 1 tablet daily. What is a critical counseling point for this medication that a technician might reinforce? A. Take with a full glass of milk. B. Avoid all leafy green vegetables. C. Monitor for unusual bleeding or bruising. D. Take only when feeling anxious. Answer: C. Monitor for unusual bleeding or bruising. This question assesses knowledge of important patient counseling points for high-risk medications, even though primary counseling is done by the pharmacist. Warfarin is an anticoagulant, blood thinner, with a narrow therapeutic index, meaning there's a small window between being effective and being dangerous. A critical side effect is an increased risk of bleeding. Patients should be advised to watch for signs like unusual bruising, nosebleeds, or blood in urine/stools. While pharmacists provide full counseling, technicians can reinforce such vital safety warnings. Question 22. Which dosage form is designed to release the medication into the bloodstream over an extended period, reducing the number of daily doses? A. Immediate release tablet. B. Chewable tablet. C. Extended release capsule. D. Sublingual tablet. Answer: C. Extended release capsule. This question distinguishes between different drug dosage forms and their release characteristics, which affects dosing frequency and patient adherence. Extended release, ER, or sustained release, SR, formulations are specifically designed to release the medication slowly over several hours, maintaining drug levels in the body for a longer duration. This reduces the need for frequent dosing, making it more convenient for the patient compared to immediate release forms. For example, some blood pressure medications are available in ER forms to be taken once daily. Question 23. A pharmacy receives a notice about a Class 1 drug recall. What does a Class 1 recall signify? A. The drug may cause temporary health problems. B. The drug may cause serious adverse health consequences or death. C. The drug is unlikely to cause any adverse health consequences. D. The drug requires relabeling due to minor errors. Answer: B. The drug may cause serious adverse health consequences or death. This question tests knowledge of drug recall classifications, which directly impacts patient safety and pharmacy procedures. A Class 1 recall is the most serious type of recall, indicating that there is a reasonable probability that using or being exposed to the recalled product will cause serious adverse health consequences or death. Pharmacists and technicians must act immediately to remove these products from shelves and notify affected patients. Understanding recall classifications ensures appropriate and timely action is taken to protect public health. Question 24. A patient's insurance plan requires prior authorization for a specific medication. What does prior authorization mean? A. The patient must pay for the medication in full before receiving it. B. The prescriber must obtain approval from the insurance company before the medication will be covered. C. The pharmacy must verify the patient's identity before dispensing. D. The medication can only be filled at a specific network pharmacy. Answer: B. The prescriber must obtain approval from the insurance company before the medication will be covered. This question addresses a common insurance and billing process that pharmacy technicians often encounter. Prior authorization means that the patient's insurance company requires the prescriber to submit a request and receive approval for coverage of a specific medication before the pharmacy can dispense it. This process is usually for expensive, specialty, or non-preferred medications. If prior authorization is not obtained, the insurance may refuse to pay, leaving the patient to cover the full cost. Question 25. Which of the following is an example of an appropriate action for a pharmacy technician when faced with a drug interaction alert? A. Dispense the medication as written, assuming the pharmacist will catch it later. B. Immediately contact the prescribing physician to clarify the order. C. Bypass the alert and continue processing the prescription if it seems minor. D. Notify the supervising pharmacist so they can assess the interaction and determine the next steps. Answer: D. Notify the supervising pharmacist so they can assess the interaction and determine the next steps. This question emphasizes the appropriate scope of practice for a pharmacy technician regarding clinical decisions. While technicians play a vital role in processing prescriptions and identifying alerts, interpreting clinical significance and making therapeutic decisions, such as resolving a drug interaction, falls under the pharmacist's responsibility. The technician's role is to identify the alert and immediately bring it to the attention of the supervising pharmacist, who will then assess the interaction and decide on the best course of action. This ensures patient safety by leveraging the pharmacist's expertise.